Okay, this is just a quick workup of a patient for dizziness. Okay, you always ask the patient, you ever had this before? Do you know what's causing it? That sort of question. Other things you can ask the patient, do they have diabetes? Are they maybe hypoglycemic? They took too much insulin. Do they have rebound hypoglycemia from eating simple sugar? Some people get that. Then, vascular causes tend to be the most common cause of most disease in middle age and older adults. The most common reason people see people dizzy, falling down, and hitting their heads is because they're overtreating their hypertension. They're dropping their pressure too low. The reason their blood pressure initially had a systolic of 170 is because that was what it took to get adequate amount of blood to the brain. Why do you have the blood pressure? To pump blood to the top of your cerebral cortex, okay, to pump it against gravity. So you got to be careful about lowering it too much with a pill, because then you don't get enough blood to the top of your brain. You might pass out. You might have a stroke. Okay, that's super common. I see that all day long, every day. That's by far the most common thing in my experience. What else? A lot of these old people, they got polypharmacy. They're on 15, 20 meds. They get themselves confused. They could be overtreating their blood pressure, have some other problem. Some medications rarely are ototoxic, just intrinsically toxic to the ear. Some of these antibiotics like aminoglycosides, for example, some other meds. Internal carotid artery stenosis, that's uncommon. Yeah, I see a little bit of that, but it's not that often that it's really significantly severe, but it can be. And a hypotensive moment, a dehydrated moment, they can get a little cerebral hypoperfusion, insufficiency, blood flow to the brain. Other things can cause hypoperfusion in the brain. Atrial fibrillation, you can underpump blood to your brain. Aortic valve disease, aortic regurgitation, aortic stenosis, all those things could do it. By far the most common is overtreated hypertension though. Let's see, you could check imaging if you want. You could do an ultrasound of the carotid artery. You can do a CT angiogram, CTA, magnetic resonance angiogram, MRA. Hypercoagulable blood, that's worth checking for. Are they hyperlipidemic? Fat sticks red blood cells together, okay? Decreases oxygen delivery to the tissues. Excessive psychological stress, sleep deprivation, caffeine, all those things predispose to hyperlipidemia, cerebral vasoconstriction, which can lead to impaired neurologic function. Okay, leaky gut and poor gingiva, those things will cause bacterial endotoxins to get in your blood, can make your blood a little bit prothrombotic. Postprandial endotoxemia, bacterial endotoxins, LPS from gram-negative bacteria, LTA from gram-positive bacteria. It will cause an amyloid transformation of your fibrinogen clotting protein to change from an alpha helix like a slinky, cylindrical, so it stays separate from the other ones, to beta-pleated sheet, flat like a deck of playing cards. So they interact, combine, can create an enlarged molecule that precipitates clots. And you get all these little tiny clots going around, can start plugging up little spots in your microcirculation of your heart, causing AFib, in your brain, causing impaired neurologic function. Root canal surgery, you can have those thioether bacterial toxins like dimethyl sulfoxide, for example, methylthiol, that can have toxic effects, including neurotoxic effect. You can have toxicity from dental amalgams, Hg toxicity to the brain. You can have other toxicities, heavy metal neurologic toxicities. You can have excitotoxins. I give an entire lectures on excitotoxins. You can have mitochondria inhibitors decreasing, energy output in the brain. That could decrease neurologic function. You can be EMF'd. Okay. Let's see what else. You can be iron overloaded as another mechanism of causing amyloid type clotting in the blood. You can check your blood labs. Check your total cholesterol, your triglycerides, your blood lipids, your CBC for your hematocrit, etc. Orthostatic hypotension, some people have it. Dehydration can contribute to it, make it worse. You could have atherosclerotic narrowing of the arteries that go to the posterior fossa, the brainstem, and the cerebellum. Vertebrobasilar insufficiency, we call it. You might have atherosclerosis in the cervical vertebral arteries and the intracranial vertebral arteries or basilar artery. You could have Bow-Hunter syndrome with an osteophyte compressing the vertebral artery in the foramen transversarium of the neck. You could have subclavian steel at the origin of the vertebrae. All this stuff is really rare, by the way. What's common? The vast majority of patients, they just got overtreated hypertension. That's what I see all day long, every day. I see that multiple times every day. Okay. Other things that are very common is just intracranial atherosclerotic disease, which is often related to overtreated hypertension, with little tiny strokes around the ventricles. We call them periventricular flare hyperintensities, or UBOs, unidentified bright objects, little hot spots, bright spots on your brain MRI, And we typically read that out as small vessel atherosclerotic ischemic disease, meaning atherosclerosis problems related to your arteries and hypertension problems related to your arteries and overtreated hypertension problems related to your artery. That's super common. I see that all day long, every day. That's where the money is. That's the kind of things you should be thinking about in a middle-aged and older patient. In a younger patient, I'd worry about this amalgam thing. Peripheral neuropathies, that can do it. You know, your balance can be off just because you got diabetic neuropathy at your lower extremity. You could have a compressive radiculopathy, compression of the nerve root going from your lumbar spine down into your leg. You can have vestibular nerve problems. That's cranial nerve 8, the nerve of balance, okay? And you can have an infection. It's super rare. Labyrinthitis, rare. You can have a tumor of it, like a vestibular schwannoma of cranial nerve 8. That's really rare. I mean, I see those about 2 a month, but you got to remember, I look at hundreds of brains. And ENT is looking for those, ear, nose, and throat doctors. Vestibular schwannoma is also called acoustic neuroma, same thing. You diagnose it with an MRI. You don't really need IV contrast. I can tell what's going on with a typical brain MRI, the IACs, internal auditory canals. You just want to get a special sequence, something called T2 space or a CISS sequence. Those are basically thin section, high resolution T2 weighted images. They enable me to see cranial nerve 8 where I don't need IV contrast. It's routinely ordered with IV contrast, but a lot of times the reason they order stuff with IV contrast is because the patient is difficult, they're old, or it's difficult for them to get to a hospital, so they just want to get everything done in one fell swoop. But if I needed the test, I'm a young walker talker with it, I would just get it without, and then if there was some unresolved question, then I would go back and get it with IV if necessary, and it probably won't be necessary. You can get a cerebellopontine angle tumor, which is a tumor of posterior fossa right near the origin of the cranial nerve 8 as it exits the brainstem and heads into the IAC. That's rare. You can get a meningioma, would be the most common thing in that location. What else? You can have Meniere's disease. Salt reduction can help. Multiple sclerosis. BPPV, benign paroxysmal positional vertigo, and they can do a special physical exam to try to elicit that. If you got syncopal episodes, they can even do a tilt table test, all this stuff. But again, most of the time in my experience, it's hypertension and atherosclerosis, and watch out for AFib. I talked about dental amalgams, anxiety attacks, panic attacks, vasovagal fainting type episodes, vestibular migraines. In an old person, they could have head trauma with a subdural hematoma. But I can tell you, for every patient with a subdural hematoma, I see probably about 70 head CTs that are normal or just have chronic atherosclerotic ischemic disease, the usual stuff. They could be a drinker, an alcoholic, and not be revealing that. So anyways, these are some of the things to think about, but the money is on all this vascular stuff, hypertension, diabetes. That's what all the patients have, and it causes atherosclerosis, and they get problems from that. Also, lots of people are exposed to toxins, excitotoxins, mitochondrial toxins, EMF, amalgams, okay, and lots of people got atrial fib. So that's where all the money is, and then all these other things are secondary thoughts, distant secondary thoughts. So don't freak out. The chances you having any of this other stuff is very, very, very unlikely. Possible, but very unlikely. Anyways, that's a DDX, differential diagnosis workup for dizziness. Hope you found that helpful.